2019, a novel coronavirus was detected. That was the start of the COVID-19 pandemic. It sent ripples across the world, ripples we still feel today. It was a challenge for everyone, and even more so for our frontline healthcare workers and professionals. I'm Ryan Funk with Multicultural. This is Together We Can, where we sit down with these healthcare workers and professionals to hear about their experiences during the COVID-19 pandemic. Our guest today is Andrea. Thank you for joining us today.
Absolutely. Thank you for having me.
Awesome. So how about you just tell me a little bit about yourself and the work that you do?
Well, I go by Dr. Agostinho, but Andrea's fine. I am a family physician here in Winnipeg, Manitoba, and I primarily work out of a clinic and see patients in that capacity. Mm-hmm.
So obviously work probably changed dramatically once the COVID-19 pandemic hit. Mm-hmm. So what was that kind of like those initial moments like for you in those maybe like first couple of weeks once we started seeing infections?
Well, there was a lot of uncertainty. We were getting a lot of information, but not a lot of direction in the very beginning. And at the time, I was working at a WRHA-run clinic, so it was very black and white, government rules, that sort of thing. So really, week to week, we were just playing it by ear at that point.
Mm-hmm. Yeah, it was a crazy period of time. Like, just looking out, there was like moments where we were seeing infection rates happening on the coast, and then it was just slowly closing in on us here in Manitoba.
Mm-hmm. Yeah.
So also during that period of time, you transitioned to another clinic. What was why the change, and what was that transition period like?
Well, So the transition I made was at the end of 2020. I was at that WRHA clinic that I spoke of, and then beginning in 2021, I transitioned to a private clinic. A lot of it was for personal reasons, but I think one of the catalysts as well was, as I said, following these strict rules, which I might not have necessarily agreed with, and not having no recourse for how I wanted to see my patients. So at a private clinic, I was in control. I could see my patients when I thought they needed to be seen. At that point in time, we were still mainly virtual visits. So at the private clinic, I had a lot more flexibility on who I could bring in to see in person.
Of course, of course. So yeah, working with patients virtually, what must that be like? Like, what are some of the challenges that you face when you can't have them in person?
Well, it really makes you realize how important pattern recognition is. So a lot of the things that they would tell us and the questions that the way they would answer would help us narrow in on maybe one or two possible things that it could be. And then if we could bring them in, we just had to do like a quick physical to figure out between those two things. Fortunately, if we couldn't bring them in, then we kind of had to hedge our bets and try to treat both at the same time without harming the patient. So it was a learning experience as we went along to try to figure out how do we navigate this. Yeah.
Of course. I mean, it's already a challenge to try and figure out, what's going on with this person? Well, what are they struggling with? So I can't even imagine what that's like trying to navigate over like a virtual space.
Yeah. There was a lot of new tools that came out around that time, things that they were trying to study. For example, how far in a set phrase a person could get to before they took a breath told us how breathless they were, if they were dealing with a respiratory illness and things like that. So things that didn't really exist before had to be created in the moment when you can't see the patient in front of you, but there's so much that we depend on just by observing a patient that is lost. So they had to replace it with these other things that were actually pretty accurate.
Yeah. So are those tools really helping now to kind of like expand upon like treating a patient? Are those tools still being used?
Yeah. So as of right now, I would say on average, maybe about 25% of patients are still doing virtual visits instead of in-person visits. So we're still using those tools. And I know there's been an explosion of purely virtual clinics out there as well as a result of this, because everybody had to learn how to do it. and it's a time-saving and
Well, sometimes someone can't make it into like a
Right.
physical appointment.
or they can't take off an entire afternoon from work, but they can step away for 10 minutes to answer a phone call, right? So it is still very much at play, and I hope it will stay around for the future.
Yeah, I mean, like once we've developed these things, like why get rid of them? Like all they can do is help improve treatments moving forward.
Yes, exactly. Yeah.
Yeah. So what do you think was the biggest challenge for yourself? I mean, you mentioned some of the things that you were struggling with and then going to private during the COVID-19 pandemic. How about we start with things before the vaccine was in place, and then we can kind of, give your perspective on how things felt after or post vaccine.
I feel like there was a lot more fear pre-vaccine, not only from the patients who were concerned about having to come in if they needed to, but also from the staff, all the staff working and just trying to protect themselves while they're caring for others, right? So I feel like a lot of the fear went down once the vaccine was out because staff weren't as concerned about catching it themselves, and then conversely the patients weren't as concerned about having to come all the way into a clinic where there's going to be other sick people, because the odds are that most people are vaccinated at that point.
Yeah, kind of takes away a little bit of that hesitancy that's kind of out there. What was the PPE situation like for you at the clinic that you were working at? Because we've talked with a pharmacist, and there's that time when it was just gone and you couldn't get access to anything.
So it was interesting. The first clinic that I worked at, again, government run, so we did have access to PPE, but even that was limited, so we would have to take turns. So 1 day a week was your day where you got to wear PPE and you got to be face-to-face with patients. The other days you had to be over the phone. And that was just their way of conserving the PPE that was available so that not 2 or 3 or 4 people at a time were using PPE in a day. I could see why they needed to do that. Poses problems for trying to get people in if they can't necessarily come in on that day, but we had to do what we had to do at that point. So,
I guess just in your opinion, what are some ways that could have helped alleviate that limited supply of PPE that you're having to kind of almost rotate at times using it?
I'm not sure that much could have been done at that point because it was a supply and demand, right? The supply was pretty much the same as it was pre-pandemic, yet the demand was 3, 4, 5
Just
times
through the roof.
as much, right? One of the very interesting things that I don't know that most people are aware of was the way that we use masks changed drastically. So pre-pandemic, if you were working in a hospital, for example, if you were wearing a mask after 20, 30 minutes, garbage, right? Whereas now you got a mask and that was your mask for the day, right? So the, I guess, physics of it or the microbiology side of it didn't quite match up. But again, we had to make do with what we had, and something was better than nothing, right?
Yeah, you're trying to protect yourself in any way you can.
Exactly.
But it's just so interesting, like how you have to adapt in situations like that.
Yeah. And it was also interesting seeing the public trying to react then using masks when it's something they've not been exposed to before as well.
Yeah. I mean, I have just a little bit of a beard, so there was a period of time where like I had to shave it off, and it felt weird for me. But you're trying to do things the best to help out our healthcare system as best we can. But yeah, it is a struggle, and like it is uncomfortable wearing a mask all day. And I mean, for our healthcare professionals, you were really wearing high-grade masks and like things that like you see the photos of when people take off their masks and just those like deep rings.
And I still wear a mask every day. It's not an N95, but a regular mask every day, because at least with how things are at this current time, we in healthcare facilities are required to wear masks, and we require our patients to do so as well. So it's not over for me.
Yeah, I that's another important thing to just like, reiterate that, there are still COVID cases out there, and for people who are immunocompromised, it is something they are still concerned about. Even though a vaccine is out there, we've had several boosters now, but for some, it's still a scary time.
Yeah. And I think part of what people forget about as well is when they think immunocompromised, they think people, who've had cancer, who are on specific immunosuppressant therapies because maybe they've got really bad psoriasis, that kind of thing. But there is also the natural immunosuppression that comes with just getting older, right? So even if you have a very healthy 75-year-old with no medical illnesses, they're still considered immunocompromised. And so there's still people that we need to protect out there at this point.
So for you during that period of time, what was some of the strains that you were experiencing in terms of just, the physical exhaustion? You're having to wear like a mask all day long, no breaks to take it off, that sort of thing. And what sort of and then just people coming in sick, what sort of physical toll did that take on you? And what was the mental toll as well?
Well, I think most people who work in this profession are pretty resilient people, so we adapt to change. It's part of the job, even pre-pandemic. So I think we adapted pretty quickly to the physical side of it. It was more so the not knowing when is this going to be over, when is this going to lighten. So comparatively now we just wear a mask, whereas before, as you said, it was full gown. It was a shield. It was a lot to just get dressed up to go into a room to speak to a patient.
Yeah, so there's a lot. And I guess just during that period of time, what was that kind of mental strain? Did you ever have moments where you're like, oh, this is never going to end, sort of thing?
Not really. At least for me personally, I was modeling it kind of around the Spanish flu, and we knew the Spanish flu took 2 to 3 years to resolve from a pandemic state to epidemic areas. And so I was kind of modeling it around that, 2-3 years, things will start getting lighter. We don't know what that new baseline would look like.
Yeah. So you had sort of a rough timeline that you were kind of going off of in your head based on previous experiences.
Exactly, yeah.
So for the public, what sort of things would you like them to know just about what it was like as a doctor during that period of time? Just kind of to bring awareness, because they're not privy to everything that's happening. If you're not in the healthcare field, you may not be aware of what life was like during that period of time, just hearing the news. And for some people it's like, oh, such an inconvenience, but it was really hard for some people.
Yeah. What would they not know? I guess that's a good question. So there was a lot of learning. So we go through 10 years of university beforehand, and then we do have to upkeep our skills every year. But this was like going back to school again in a way, because constantly every day there was new studies, new information coming out. So trying to keep on top of that information while also still doing your everyday 9-to-5 job was something that I don't think a lot of people were aware of, that we were almost working time and a half in a way to try to keep up with all the information that was coming in. I think it's super variable depending on what situation you were working in. So I was working in a private clinic, very different for doctors who were working in the hospital or in the ER as well. I think they also got a lot more volume of people coming in, and we're run a little ragged, unfortunately. So for me, it was nice in that I still had an hourly limit, start here and here, and try to do as much as I can between that. Whereas
you had a little bit more control.
A little bit more control, exactly, yeah.
Oh, that's very interesting. So did you also have one of those COVID books where it start off as 12 pages and then just continue to grow to hundreds and hundreds and hundreds?
Well, I try to save trees, so I didn't print anything. I did have an email folder that maybe started off because we got weekly updates through our colleges and our private associations, that maybe sometimes we got the information a little bit ahead of the public as well, just so we were available to answer questions when the information did come to light. And that folder, I still haven't gone through it to clean out, but quite big.
So what were some, in those early days, what were some of the questions that you were hearing from the public? What were some of their concerns?
I think I didn't get as much questions as anxieties and fears about what's this going to mean for my life? Am I ever going to get to see my family again? Those sorts of things. And just a lot of the fears that they might not necessarily have been able to bring up with other people when they were in seeing me for something simple, say a rash. Half the appointment turned into their fears and anxiety about COVID and their general health and the health of the world, really.
Well, that's something like a lot of people may not think about, is that, when you go to the doctor, some of that is venting to them about some of the stresses you have. Maybe, that rash, you're like, oh, is it something more? Is it related to this? And it's a way to kind of just get out some of those pressures sometimes. Maybe an unintentional person to talk to.
Support,
Yeah, unintentional support.
And even if they'd heard the same information 2-3 times, either from the news or from a loved one, it's different hearing it from a healthcare professional that you trust, right? So it's not like going to a random doctor that you've never met before in a hospital setting or a walk-in setting. These are patients that I've had for, at that point at least, 4 years or so.
Yeah, so there's like a level of trust.
There's a level of relationship.
Yeah.
Yeah.
Yeah. So, I mean, for the public, when we were listening to the situation, we kept hearing things and everything was changing in terms of listening to our healthcare professionals. It was frustrating sometimes because, we weren't quite sure what was going on. Of course, science is always evolving, so things always changing. But for the public, that can be frustrating when you're not quite sure on everything. So as a doctor, what were your feelings about the information that you were receiving? How did you feel about transparency and just kind of the directions you were receiving from our leadership positions?
I feel like they were actually pretty transparent. I do feel like they could have asked for our opinions more. I know that with the time crunch, wasn't feasible to necessarily poll everybody on how they thought that the province should proceed. So they had their few experts that they relied on. And for the most part, I think they did a really good job. In terms of the frustration around the different types of information and being unsure, I mean, we had that same frustration as well. It was more so frustration because we didn't want the public to lose their trust in us, right? So the closest example I can give you is, let's say, treating cholesterol. It's been studied in hundreds of countries. North America, Europe, the United States were pretty much all on board with how we treat cholesterol and what our targets are, right? We didn't have the chance to do that with COVID. As the information was coming out, we were reacting to it, and some countries reacted one way, others countries reacted the other way. We didn't have that chance to collate and get everybody on board, and so I can understand the public receiving all this contradicting information, how it'd be frustrating for them. This happens with everything. It's just usually before we get to that point, there's a consensus, and at this point, it was so fast. There's no chance to have a consensus on anything, right?
That's the struggle in terms of science. If someone is not aware of how science work, it can feel a little weird. It's like, well, you said this the one time
3 days ago.
Now it's this. But I'm glad that you feel our leadership was doing a good job. Now that we're kind of out the end of this, but although there are still cases and things have adjusted to what is the term? A new norm, or a new normal. What do you think we can learn from what happened during the COVID-19 pandemic, and what can we just know moving forwards?
Well, in terms of what we have learned is that it's very easy to become divided, right? The smallest difference of opinion, and you saw that entire families would stop talking to one another. And so how much harder it is to stay united rather than be divided, I think, is one of the biggest things that we learned from the pandemic. And I think in general, we know that this is something that could potentially happen again in the future, just because there is so much air travel. We have such a high population on the Earth right now. Previous pandemics were usually hundreds of years apart. Ours might only be 50 or 60 years apart. So at least now we are prepared should this happen again, have protocols in place, kind of know where we're going should it happen again in another 50 years or so.
Yeah, we have an idea of what it was like, and we can have those lived experiences to help us make good decisions.
Exactly.
Well, thank you so much, Andrea, for taking the time to share your perspective with us.
Absolutely. Thank you.
I'm Ryan Funk with Multicultural. This was Together We Can. Thank you for watching.